Hi everyone, are you sick of polycystic ovaries? Have you had health professionals give you pills and tell you have to live with this for the rest of your life? And are you tired of that feeling of hopelessness? You see, I do understand how you feel. Waking up in the morning and feeling totally dejected because you've got more acne on your face or a few more hairs on your chin. Worrying about not getting your period. Worrying about getting your period because you're just not sure when it's going to come. And fed up with the pain too. Pelvic congestion and ovarian cysts make you feel bloated, like you're about to explode. And then worrying about not getting pregnant or getting diabetes later. And now you're depressed that nothing is working, and yet you keep taking the pills. And right now you're over it. So let me ask you a question. Have the steps you've been taking to date been effective? Who here is feeling frustrated right now because no matter what you've done, nothing has changed? You feel like you've gone to every health practitioner and no one seems to specifically understand this problem. The fact is that as each day goes past, you feel more and more depressed about it. And have you noticed that you feel more anxious too? That every little problem seems like a massive deal right now. And maybe you're feeling overwhelmed about it all, that you've had enough. Well, today I'm going to give you the solution, the information that very few other medical professionals will share with you. And the reason that I'm able to do that is because I have over 25 years experience working specifically with health, nutrition and polycystic ovaries. You've lived with this. You've felt how terrible it is. You've gone to doctors and doctors have said, well, yeah, you just got to put up with it. You've jumped online and you've seen countless articles and tried countless things to fix it. Well, what if I told you that having specialised in this for so long, I'm one of the very few people in the world that's going to give you a different answer. Someone who's going to give you something you can do today. In the next 30 minutes, I'm going to let you into my 3 biggest secrets that few other doctors and health practitioners know about polycystic ovaries that will confirm what you already suspected. You can fix this disease and you can take control of your health. In this webinar, first we'll talk about how you got polycystic ovaries, and that's really important. Because when you know what's causing the problem, then you can take steps to fix it. We'll talk about symptoms such as pain, acne, weight gain, hair loss, depression and anxiety, as well as other symptoms. We'll cover all the important problems that you might experience. And then we'll talk about the real reasons why you've got polycystic ovaries. I'm going to clarify what it means, and also all the different ways in which your body is working against you. And that brings us to the final issue, what you can do about it. You see, I know you're probably feeling frustrated and anxious about this. What does it mean? Will I get pregnant? Will I get diabetes later? And you might be feeling that you've been pushed around by the system, given medications and sent on your way. Just take the pill and some diabetes tablets and you'll be fine. But you don't feel fine. You want to know more and you want to be able to do something about it yourself. You want to feel that you are in control of your body, no one else. Well, I can give you back that control by telling you all about my complete plan for fixing up your polycystic ovaries. Now, we're going to cover all that today, and it's a whole lot I can tell you. So to get the best from our training today, I recommend you get rid of all distractions. Turn off your phone, close your email, and listen closely, because you won't be hearing this information from anyone else. Okay, so we've covered how you need a new way of freeing yourself from polycystic ovaries, and now we're going to clarify exactly what it is. Before we start, I want to clarify that polycystic ovaries has many names and abbreviations. There's PCOS, PCOS, and even PCOD. Polycystic ovarian syndrome is such a mouthful that I'm going to call it PCOS from now on till the end of the webinar. Did you know that 10.2%, that's 1 in 10 women, will suffer from PCOS and nearly all will not know how to fix it? Approximately 1.2 billion women in the world are aged between 18 and 40. And that means 120 million women worldwide who have PCOS. That's a huge problem. And it also means you are not alone. In the past, we didn't know how to fix PCOS, and most of the time women were just given a pill. For years, I struggled to help women other than just medications, and it was frustrating, and at times I felt overwhelmed. So I studied research from all over the world, not just PCOS, but diabetes as well, until I was able to piece together all the parts of the jigsaw. I pulled together stats from gut health, vitamin deficiencies, detoxification, and all the latest PCOS research until I found the ultimate solution. And then I put it all together in one program. You've no idea how much time and effort that took, but the rewards have been well worth it. Just the look on patients' faces when they tell me they're pregnant or they've got rid of their acne or facial hair. It's just a brilliant feeling and a grateful reward for all that hard work. And now I want to share the benefits with you too, to show you that there are many things that you can do to free yourself from PCOS. Now you might be asking at this stage, who am I? Well, I'm Dr Shirley MD. I'm a medical doctor originally from the UK and now living in Australia. I'm a professor and family doctor with over 25 years experience in dealing with women's health and over 15 years specifically with PCOS. And of course, my family is very important to me too. You see, I've experienced it all myself. This is our blended family. I was a stepmother first, and then when I wanted to add to the family, I found I couldn't get pregnant and was diagnosed with infertility. And I was gutted. I was so upset about it. But luckily, after a variety of treatments, I fell pregnant. And of course, after more treatment to achieve a second pregnancy, we got twins. Well, that was a big shock, but a wonderful one too. And now they're all adults. And I bet you're surprised, there's actually snow in Australia. And yes, if you're wondering, I do ski myself. It's a great way to spend time with a family, and I also believe in getting outdoors and having fun. I'm also committed to fundraising for Indigenous charities that educate children on how to eat healthy and grow their own vegetables. After many years as a professor and with my own health experiences with infertility, I felt we were too reliant on drugs and surgery to fix every health problem. And I started looking at other therapies as well. I was so convinced that health was directly related to diet that I set up the Food Coach Institute in 2011 to train people as health coaches to go out and show people what healthy eating was all about. I've been frustrated too with the lack of information and help for young women who suffer from PCOS. Over the years, I've put together all my knowledge and expertise into a holistic program that provides all the tools that women need to knock this disease on its head. I'm going to tell you all about the program later at the end of this presentation and show you how you can enroll for us. Now, regardless of whether you take up this offer, I'm confident that you'll get tremendous value from me. On top of that, if you stay to the end of the webinar to find out more about the program and how to access it, I have a special gift to reward you for staying right to the very end. We're all really busy these days, so I know how much of a commitment that is to stay to the last minute. And that's why I've put together this extra help for you. Now, I want to make this very, very clear. I have to, as this is a medical webinar. I need to give you a legal disclaimer that even though I'm experienced, this does not equate to a consultation. If you want a real consultation with me, you're very welcome to book one in. But please know that every medical diagnosis requires a full insight into your medical history and your current health level. That said, everything in here is up to date and is advice that I have given to many patients before. So as a next step, watch the rest of this webinar, take the information in, and if you'd like to, you can book in a consultation with me, get support from me and my team, and download a special program at the end. And here's some examples and case studies. Take Sally. She was very fit and seemingly healthy, but she was diagnosed with PCOS. She had acne outbreaks from time to time and had trouble getting pregnant. I worked with Sally over a period of 3 months. You see, despite Sally being very fit and going to the gym 6 days a week, her metabolism was poor and very carb dependent. At the same time, she was short of some important nutrients and wasn't detoxifying very well. Gradually she improved, and with all the treatments we were doing, imagine my surprise when she came in for a routine visit and announced she was pregnant. Well, we were both over the moon. And then Rebecca was overweight, had lots of sugar cravings, facial hair, and was very depressed and frustrated with it all. No matter what she did, she just couldn't lose weight. So I put her on my program, we did all the treatments, and my God, what a transformation. She lost weight for the first time in 5 years and was delighted. Her facial hair disappeared and we smashed out her cravings. Now she's changed her job, going on holidays and having a great old time. We were so happy we did it together. And now she knows how to keep herself well and keep the weight off forever. So I know I can help people. I can help them lose weight, improve their mood, especially depression and anxiety, get rid of acne, stop the pain, get their periods back, balance hormones, get rid of facial hair or stop their hair falling out, and finally help women improve their fertility and get pregnant. So you're in the right place if you want to learn how to really fix your health once and for all, rather than just take medication. That means you take control, are well informed and able to make the right decisions about your health. No more Googling late at night. You just get confused and more anxious, or wondering, what does it all mean for me? I'll guide you through the whole process and help answer your questions. Give you the real lowdown on what's right for you from all my years of experience. We're going to uncover the gold, and that's the simple things you can do today. Foods that you should take out of your diet, foods that help gut health, what supplements are the best for you, what simple exercise you can do without a gym, and what not to do if you want to get healthy. So first of all, let's find out who we've got on the webinar today. In the pre-webinar survey, we asked if you were a woman with polycystic ovaries or PCOS, a health practitioner, a fitness practitioner, or other. And here's the results. From them, you can see most of you are women who've got PCOS, but there are also some health practitioners and fitness professionals too. It doesn't matter who you are. This information and my confidential knowledge and insights into PCOS is going to help all of you manage this disease, whether it's yourself or a client. At this stage, I'm going to go right back to the beginning because I think we need to clarify some issues and definitions right from the start, so we can build on it to show why we need to tackle certain areas when we talk about treatment. So I apologize if you've heard all this before, but I think it's best if we're all on the same page right from the get-go. Let's start with exactly what is and what is not PCOS. This is a disease that causes multiple cysts on the ovaries. Now, a lot of women are told they have PCOS because they have an ultrasound and lots of cysts have been seen on the ovaries. Is that PCOS? Well, the simple answer is no. The world experts have got together at a large conference and decided that cysts on their own does not mean you have the disease. You have to have hormone abnormalities as well before the diagnosis can be made. So on the one hand, that's reassuring, but on the other, if you have cysts, you want to know why they're there. And sometimes women are confused because some doctors say, yes, you have it, or others say, no, you don't. And this is the reason why. You need the hormone problems as well as the cysts to be strictly diagnosed. That's not to say the treatment is any different. You still need to do something about it. So let's tackle the first important question in our webinar. How does PCOS happen? Well, it's a complicated mix of hormones that I'll try and make as simple as possible for you. Let's go back to the very beginning, to when you were born. When you were conceived back in the day, your ovaries developed with all the eggs you would need for your entire life. On the day you were born, your ovaries and reproductive system had everything it needed to produce more baby humans. The number of eggs you had for life was already complete, and that's usually around 2 million eggs. That's an insane number, isn't it? Then when you reached puberty, your body started to prepare for pregnancy by selecting an egg, or ovum as it's called, each month to be released from your ovaries to make a baby with a visiting sperm. This egg could be released from the right or the left ovary, and they often take turns. Within your ovaries, roughly about 1,000 eggs every month would want to be selected as the winner, the one to get released. It's amazing, isn't it? So every month in your ovaries, the eggs would have a sort of beauty pageant, like The Bachelor, to pick the fairest of them all. Each month, about 30 of these 1,000 eggs would be ready to put themselves forward for the shortlist and apply to be crowned Egg of the Month. To start off the process, FSH, a hormone from the brain, would tell the eggs to get ready and stimulate them to swell up. FSH would be like a TV ad or a shout out telling the eggs to get ready. However, there are so many applicants and they tend to be a bit disorganised and competing with each other, so they all needed a manager. Step forward the hormone AMH, or anti-Müllerian hormone. AMH is a team of fixers, just like bridesmaids, who would race around the ovaries getting all the eggs ready. And the more eggs applied for the competition, the more AMH would be made by the ovaries. About 30 eggs would make the final competition. The shortlisted eggs would all grow a bit to show off their best features. At the end of the day, the brain would be the panel of judges, and it would decide which egg had won and would be released to waft along the fallopian tube to her blind date with the bachelor sperm wearing her frilly crown. The other eggs not selected would normally die off and disappear. When the egg had been chosen, LH from the brain then starts the release of the egg, or ovulation. And it also encourages hormones to rise to prepare for pregnancy. So that's what happens in a normal, healthy young woman. But what happens in PCOS? What we definitely know is that the normal way this little bachelor pageant would play out doesn't happen in PCOS, and that's why we end up with lots of cysts. For a start, FSH is often low in PCOS. That means the eggs do not get ready for the pageant. The eggs stay immature because no one is telling them what to do. There are lots of eggs sitting there as immature cells, not getting ready, because no one has sent the shout out to get ready, grow and mature. Without the FSH, none of the 30 shortlisted eggs will make it to maturity. And so they hang around as cysts, looking glum, not knowing what to do. So when you have an ultrasound, lots of cysts are seen, which are eggs which haven't matured properly. Because there are no eggs getting ready, the AMH starts provoking more and more eggs to start the process, and high levels of AMH are common in PCOS. And finally, because none of the eggs are ready to be released by ovulation, LH hangs around too and makes trouble. It starts making testosterone from estrogen and progesterone, and too much testosterone encourages acne and facial hair. So, do you understand how PCOS happens? I hope I've made it clear for you all. So let's have another quick quiz. In the survey, we asked how many of you had any of these 3 symptoms: acne, facial hair, or other body hair such as on your arms or legs. And from your quiz results, we can see that over 60% suffer from acne on their face, so it's pretty common. And a lot of you, about 35%, have facial hair and a smaller number of problem hair in other parts of your body. But that's quite a lot of you, so these are common problems. Okay, so now we move on to the crux of the matter, our second question. Why does this happen in PCOS? Well, the first reason is high insulin. This has a big effect on your hormones. It increases LH, which is the hormone causing a lot of your problems, and it also raises testosterone on its own. So you're getting a double whammy of testosterone producing acne and facial hair. Now, this can happen even if you're fit and athletic. Don't think just because you're slim you can't get this disease. I've seen so many young slim women with this problem too. It's not so much about overeating, but it's about how your body makes fuel. If your body relies on carbs for energy too much, this will push your insulin too high. Your body should ideally burn carbs and fat for energy. And burning fat for energy is far, far better for endurance, weight loss, and general health than burning carbs. You see, in your cells, you have little battery packs called mitochondria, and these make all your energy. Now, we traditionally made energy from fat, so that when we were trekking around all day looking for food, we could produce energy all day. And fat is a very efficient way to carry energy around. But we do need carbs as an emergency source of fuel, such as for running away from predators or hunting. What's happened is that a lot of you have grown up using mostly carbs for energy because we were all told that fat was bad for us. We know that's not true now, but our metabolism is used to burning carbs, not fat. Some of you who are sporty will also fuel up with carbs like pasta and sugar gels. But there is a downside to carb burning. It creates a lot of inflammation while it produces energy, and that's not good. If you carry on relying on carbs for energy, it burns out your pancreas, the organ that makes insulin, and then you end up with diabetes and all the horrible complications that go with it. Now, we don't want that to happen, but PCOS is like a warning sign. It's telling you that if you don't change your ways, then you're putting yourself at risk of diabetes later on. Luckily, I know ways to fix this and bring your risk right back down to normal. You see, taking medication will bring down your insulin for now, but it's not fixing the cause of the problem. So the right way to approach this problem is to tackle the mitochondria and get them burning fat to make energy. But it's not just about cutting sugar and carbs. Just going on a keto diet is not going to solve the problem by itself. Another common problem is lack of the right vitamins and minerals. I've seen so many PCOS sufferers that are so short of the right minerals, especially zinc, iron, magnesium and iodine. And then there's vitamins, vitamin D from sunlight, vitamin C and B vitamins. If you're not getting these in your diet, then you will struggle to make all your hormones correctly. These vitamins and minerals are the building blocks of your hormones, and you can't make them without these nutrients. It's like trying to make a Lego spaceship without all the right pieces of Lego. It just doesn't work. Intensive exercise also increases the amount of minerals and vitamins you need. So any really intensive exercise like CrossFit or marathons can mean your hormones are missing out. Extreme exercise also creates a lot of inflammation, which interferes with the eggs and your hormones. And that's one of the reasons why thin, fit girls can also get PCOS. Now you might be saying, well, I have a really healthy diet. I eat really well. Sometimes, though, you don't absorb nutrients well from a healthy diet because your gut isn't working well. And that brings me on to the next reason. Gut health is vital for everyone, but especially if you have a disease. Not only do you need great gut bacteria, but you also need the gut lining to work well to act as a barrier. If not, you get leaky gut. And reason number 4 is inflammation. Now, we've already talked a little bit about inflammation, and it's the basis for many diseases, and a high insulin is a common cause of inflammation in PCOS. Intensive exercise is another cause too. It's like a fire in your body that needs to be quenched with good antioxidants like vitamin C. And the 5th reason is toxicity. Toxicity is another thing that creates inflammation. If you're eating a lot of processed food or you're exposed to pollution like BPA from plastics, this can play havoc with your hormones and fan the flames of inflammation. Now we know why we get PCOS. To complete the picture, let's look at what other symptoms you can get with it. Girls often tell me about their anxiety and depression, and it's no wonder. You've been left alone with just your pills to keep you company. It's understandable you feel anxious and worried. It's normal to get depressed about being sick. And all these issues are made worse when you have inflammation in your brain and not enough minerals like zinc to make your happy brain hormones like serotonin. But the good news is we can fix this. Building up your nutrients and calming the inflammation will get you out of that brain funk and put a big smile on your face. It's not hard, you just need someone to guide you through it. Next, weight gain from imbalanced hormones, a sluggish thyroid and inflammation. Often, but not always, happening with PCOS. But you see, getting your body in fat burning mode will change everything and will be a permanent fix to your metabolism and an important step to fixing your weight problem for good. So what other symptoms do you have? Many of you have said anxiety, weight gain, gut problems, but also pain, abdominal pain, no periods, problems getting pregnant, and also hair loss. And now we get to the heart of the problem, our third and final question, what you can do about it. Now, you may have been given medication like the contraceptive pill or diabetes tablets, and that will control the disease and keep it at bay. But it won't fix the problem, and it won't address the real causes, and it won't stop you getting it back if you have to stop the pills for any reason. And finally, it's not really going to reduce your risk of diseases later on. You need to address all the other reasons we talked about earlier if you're going to get rid of this disease for good. If you tackle these problems, recovery can start today. Sally noticed improvement straight away from changing her diet. Her sugar cravings reduced and she was able to feel energetic throughout the day without snacking and getting blood sugar lows. Her acne improved within a couple of weeks and she felt freer and clear-headed. And there's plenty of evidence that holistic treatments work for PCOS. In one study of acupuncture, which is known to reduce inflammation, 29% of patients were successfully ovulating and producing healthy eggs within 3 months, while in the control group, less than 1% did that. In another study, those with vitamin D deficiency had a 40% less chance of ovulating. So just bringing up your vitamin D levels to normal with some sunlight can lift you out of that group altogether. Similar work with vitamin E shows significant improvement in pregnancy rates. And in an Australian study using herbs to calm inflammation and balance hormone, a 33% improvement in regular ovulations and cycles was achieved. Other studies have looked at vitamin A, B vitamins, even fruit and vegetables. Then minerals like zinc, chromium, magnesium, selenium and calcium have all been linked to improved function in PCOS. omega-3, melatonin and probiotics complete the picture. So when you put all these steps together, just imagine the results you could get. Take Rebecca. Her sugar cravings kept her eating sugar and being carb dependent. We fixed up her diet, gave her probiotics, the right supplements and easy to maintain exercise. She started feeling more energetic within 2 days, was sleeping better and had consistent weight loss within the next 6 months. She was ecstatic when her periods returned and she was much better at managing her anxiety. These case studies and the research is all the proof you need to show that this approach works and can produce unbelievable changes in your health. So what can you do right now to manage your disease today? Well, first, remove highly processed foods. This reduces your toxic load with chemicals and preservatives and bad fats. Cut out the sugar too. And here's a secret tip. What time of the day you eat carbs is a very important factor. And how you introduce healthy fats instead of bad fats is important too. And finally, how you exercise can really influence whether you become a fat burner or not. Then you want to eat foods that are good for healthy gut bacteria, such as fermented foods. And also prebiotic foods are good to feed the healthy gut bacteria. And here's a list of them on the left. So after all this information that we've covered, where are you now? And why did you really listen today? I'm guessing it was to find a better way to help yourself get healthy and beat this disease. Would you like to know more? As I promised you at the beginning of the webinar, I would show you how to get more help at the end of today's presentation. See, lots of women are bewildered and confused. They tap into Dr. Google, see lots of conflicting advice about what to eat, what supplements to take, what exercise and what medications. And then they end up in my office scared and frightened. So many things going right in their head and they need a friend and a professional to guide them. Someone they can trust. Common questions I get asked are what probiotics are the best for me? What supplements are the best to take? How will it help my PCOS? And are there any dangers and which ones should I avoid? And then we've talked about what you shouldn't do and what you should cut out. But what foods should you eat to be healthy? And how can you be clear and confident about this? Now, I hope that you feel more confident because today I've given you clear information about 3 of my gems. How the disease happens, why you have PCOS, and what you can do about it. But I can also give you a 4th gem, and that's a guiding hand to help you through all the process. And that's the biggest gem of all, because that way you avoid all the confusion, have a clear program to follow, and also a trusted friend and professional to help guide you along the way. I hope you realize that what I've showed you today is the key to your success, to tackle all the reasons for PCOS together. The question is, how will you do it and how will you take action? So you have a choice. You can do it the slow way by trial and error. It took me many years to get it right, and it has saved my clients years of frustration and fear, spending hours on the internet, sitting up late at night, and then having no one to ask questions of. But you could also take the shortcut, having all the hard work done for you and all the information in one place. And access to a friendly face, a trusted professional who can answer your questions and guide you to the right place. You could do trial and error. There's plenty of pages on the internet. You could try one and then the other and then another. It's time consuming, confusing and slow again. Or you could float around in the dark, not doing anything and feeling out of control. You see, what most people do is nothing. They tell themselves they're going to do some independent research, and maybe you will for a couple of minutes, and then it's going to be all too hard. You can identify with that, can't you? You keep meaning to do it and you're full of good intentions, but things keep getting in the way. And now you're 3 or 4 months down the track and nothing's got better. If you'd acted today, if you'd done something, you could already be on the road to recovery and feeling 1,000,000 times better. Wouldn't that be a better solution? Picture yourself living the life that you dream you could be living. Picture yourself lying on the beach, having a family. Picture yourself not having to lie down every few hours to rest or having a coffee to get back some energy. This is what you can do if you're willing to put in the work, and I promise you, I am willing to help you along the way. I've built this program to help people with PCOS and get them to shift quickly and easily from A to B. This gives them the confidence to move forward. It's clear information, easy to follow plans, and with all the backup you need. It's an A to Z, nuts and bolts system to help shift you from confused and dazed to confident and well, and putting you back in the driving seat to your health and well-being. It's a guiding hand through the maze. My program is designed to give you these 5 major results: understanding of your disease, the solutions that work by a tried and trusted method, an approach which treats you as a whole person, not just as a disease or a pelvis, but treats your whole body as well as your mind and soul. Confidence in your ability to manage this and get to your optimum potential, and a great future that will keep you healthy for years to come. This program will help balance your hormones, help you lose weight, fix your skin, reduce cysts, improve your fertility, get your periods back, reduce anxiety, and help you feel full of energy and vitality. Of course, this program is not for everyone. Sometimes people just want to take the pills, live with the disease, and wait to see what happens. And that's okay. But that's not what this program is about. This is about freeing yourself up to a life that's full and fun. Of course, it's not a magic pill either. But it's about getting to grips with the reasons why you have this disease and taking action, feeling great, and having the freedom to live the way you want to. Think about what it's costing you not to take action. The same old symptoms like pain and bloating, fretting over not getting your period, taking daily medication, worrying about your future and your chance of having a baby. So what's stopping you from taking action, feeling free and this good? Here's my special offer for you today. As an easy next step, I have put everything you need to know into a program that medical professionals would sell for thousands of dollars. I'm selling this to you for $79, which is nothing. It just about covers the cost of putting it together. But what it's going to give you is all the background you need to understand it, the steps you need to take to overcome it, and finally a chance at freedom. A chance to live that life that you want to live. But guess what? There's more. The program starts with an information video course which gives you all the lowdown on the principles of this program. That's where I'm coming from. Then follows the 6-week eating plan, which gives you a meal plan for each week. And this is something you can keep repeating until you make it a way of life. You can also order my supplement program, which is the perfect balance to the meal plans. It really helps when we're short of important building blocks to make hormones. Then we can add probiotics to improve gut health. And healing leaky gut can be a priority to absorbing those vital nutrients. And there's also an easy exercise plan that requires no gym membership or equipment. And finally, the whole program put together contains over 50 videos with recipes and short how-to videos to show you how to cook those delicious meals for you and the whole family. Because once you've made the commitment to make the change, I'm not going to leave you high and dry either. I'm going to offer you my consultation services. That is me to hold your hand the whole way. Not one of my representatives, but me personally. So once you download the program, I'm going to send you an email with links on how to book a consultation with me, Dr. Shirley. And it's totally up to you. If you want to book in to have a consultation with me, you can book in whenever you need. And it's exactly what a doctor should be billing for their support. So to summarise, to get the video course valued at $149, the 6-week meal plan at $49, the supplement information at $39, gut health advice at $47, the exercise plan at $37, and finally, the total library of available information videos at $59. So the total value of the program is $380, but I'm not going to charge you $380. Because I want this to be affordable for everyone, so that no one has to say, I can't afford to get better, I'm offering this complete program for $79. And at the same time, you will get an additional 2 recipe books as free downloads, so that you have everything you will ever need to get your body and hormones back into balance. So with all that great value, it's a real gift. And if you sign up today, I'm going to throw in my Smart and Sexy pack, incorporating my Boost Your Brain for Better Business and my Chocolate Detox. Great for chocolate lovers everywhere. So now it's time to act. Press the button on the screen. If it's not showing on your video link directly below, I'll put the link there. Share this with anyone you want. This is something that I've set my heart and soul on helping women to achieve. And now it's your turn to live the life you can. There's also 100% money back professional guarantee. If you don't think it's excellent, I will give you your money back. But I want you to stand up and take action today. I sincerely appreciate you investing your time and energy into this webinar, and it shows how special you are and how committed you are to achieving your goals. And that's cool. There are very few people willing to do what it takes, and obviously you're one of those. So thanks so much for attending, and here is your free download. Copy this address into your browser to access your ebook. And thanks also to those who have just signed up. Great job for taking action so swiftly. And here's the link once again for those of you who want to take action today. I look forward to welcoming all of you to the program and to changing your life for good.